Right. So as Dr. Sinha, in the beginning, he put up this slide showing the different TPA schemes that were there. So I also just picked up this from the internet so that we get a generalized idea about there is so much in the market that is available to us. It is actually a cafeteria. If you come to think of it, if you're all right to just work hard a little bit in the beginning, to get empaneled upon all these schemes and to just get the Rohini certification done. After that, approaching these companies, they definitely want, because see, they are all also in competition with each other, right? So they all want more and more hospitals to get added to them. So it's not a one-way traffic. If you will benefit, they will also benefit by adding the number of hospitals. And then, of course, claim settlement ratio, all those things, all the millennial patients that we have these days. Also, we need to remember one thing. See, we are operating mostly when it comes to cataract, we are operating people who are old, who are about 50, 60, 70 years old. But most of them are benefiting now with insurance policies of their children. So many times you see that, somebody who's working somewhere, their parents are attached to them through their insurance policy. So you have to be appealing to the millennials also. It is the children who take the decision for the parents where they want to go and they want to get their surgery done more often than not, rather than the parents taking the decision on their own. So all of them, they will search the internet for claim settlements. What is the claim ratio settlement? Where is the biggest advantage that they are going to get? Believe me, 90% of them, and all my seniors will agree, are not interested in the vision. They are interested where I will get the maximum benefit monetarily. Kahan se mere ko maximum benefit milega? सबसे अच्छा लेंस डल जाएगा. Whether I read or I don't read, I want a multifocal lens. My father is educated. He does not know how to read. If I somehow can manage to get a multifocal lens in his eye, I'll put that. Irrespective of the fact he likes going for a evening walk and he finds it difficult in the street lights, does not matter. Again, so then when I was going through the internet, I found this is an even bigger list. This entire thing, there are above, say about 70 to 78 insurance companies right now with over 10,000 people who are registered with them. So that makes a huge chunk. So why empanelment? As mentioned earlier, I'm just summarizing: cashless, single line billing, high affordability for the patient, and high patient inflow. Now this high patient inflow is not just direct high patient inflow. People come with relatives, and we have to think of it as a sort of a society amongst the patients also. If one person is getting operated at your center through an empanelment and your surgery has gone off well and that patient is happy, then that patient will sort of have an influence on people who do not have empanelment, who do not have insurance. They will also walk into your center. So all of this is interlinked. I'll share an anecdote. I did operate on a patient who was a bank employee, and that person, I was not on the panel for that bank. They would get reimbursement after I did give them the bills. So that person got the surgery done for his wife, was very happy, and immediately he put it on his WhatsApp group of the bank that, you go to that center and that center charges you that much. And there was one complaint also on that center for some reason, for rude staff behavior. I went to the center hassle-free. My patient is very happy and the staff was courteous. I've got all my claims. Why don't all of you also try this? And believe you me, within the next 6 months, from that very bank, from that very branch of that very bank, I operated 5 patients. So this is all indirectly coming to you because you were able to get a system in place. Even if you are not empaneled, you were able to give the proper bills that they were looking for. Consumables have to be billed separately. Your lens has to be billed separately. OT charges separately. Surgeon fees separately. So the other thing I got to know from that very patient is that, sir, wo consumables to वैसे हटा दे. They will not give me money for the consumables. So if you can increase your surgeon fees, they will have to give me money for the surgeon fees, and it's beneficial for you also. You increase your consumable bill, you increase your surgeon fee bill. So I think as we were discussing in a previous chapter of Youthful IRSI as well, the next future way has to be increasing your surgeon fee, decreasing the fee for your consumables, decreasing your OT charges fee, and increasing your service fee. It is your skill, your talent that you are asking money for, and for that, the insurance company can never say no. So this, as Dr. Sinha claimed, I think this is one for the future. CGHS, ECHS, ESI were yesteryears. Of course, they are going to continue. But this Pradhan Mantri, Ayushman Bharat Yojana is going to cover. In fact, I would also like to share that an piece of information that I gathered very recently. This Pradhan Mantri Ayushman Yojana is not going to be remaining only for the poor. They are coming with a scheme 1 and a scheme 2 for this, wherein just like general insurance, you will have to pay a very little amount, and anybody who pays that amount will also get covered into this scheme. So that is their phase 2, phase 3 of this scheme. scheme. Phase 1 was for the poor, where you don't have to pay anything. You're below poverty line. You have that red ration card, and you can get empaneled onto this. The scheme 2, scheme 3 that is coming into this is going to be for the middle class, for the upper middle class, which constitutes a high percentage of India. Talking about the government, what the government is doing. So this was of course earlier. This is from earlier, that they wanted to make India cataract free by 2022. 786 lakh cataract patients to be covered in the next 5 years. Budget of 756 crores was allocated towards the program, and the scheme was to render rupees 2,000 as financial assistance for each operation, including the cost of lenses. So this was apart from the Ayushman services, where you do get, I would say, still a decent amount, rather than your national controlled blindness, your district controlled blindness. All those are also there, which a lot of charitable services, they eye because of the high numbers that they do. They do get an amount of money, which is of course higher than the amount that is getting into the system, but you need extremely high volumes, and it has to be a very efficient system. That can only be done when you are inside a corporate or a charitable institute. Now, cracking rural India, I feel that is one thing that is still far-fetched for insurance companies. The Ayushman Bharat scheme, as I said, this is the one that is really cracking rural India very well. Of course, there are fraudulent cards. One must be very, very careful. People are getting cards made from Jan Seva Kendra for giving 200 rupees. They get a card made. You have to have a trained person in your facility who knows, who is an Ayushman Mitra. You have to send them to the government facility to train them so that they can detect these fraudulent cards. So otherwise, you can do the surgery. Patient will go home happy, and only lip service is what you're going to get. You are not going to get any money from the government, because the government will say this is a fraudulent card. There are a lot of things that, the parameters that are there in that card, it has to be linked to your ration card. The name has to be exactly the same. A lot of times we get patients in our practice who say, who are ill-informed, and who would say that, हमें कहते हैं कि 5 लाख रुपया इसमें मिलता है, तो अब इस 5 लाख में से कितना कट जाएगा? आप 5 लाख का ही लेंस डाल दीजिए. You get these people, you have to educate them, and it becomes extremely difficult in your practice to educate them. So I would suggest invest in a person, pay that person nicely, because he's going to take a lot of headache out of you. He's going to take a lot of headache away from you. That person should be trained from the relevant government organizations and in TPA to answer all the queries of your patient. Exploration versus exploitation. Very thin line, very easy to explore, and we must explore, as everybody said in their talks before. We must get paneled, but be very careful. You might get exploited out of this also. How you can get exploited, as I listed out, multiple ways. As I asked a question to Dr. Sinha as well, you might get very delayed payments. You might get fraudulent patients. Those patients might create a ruckus in your OPD, saying it's not my fault. This is my card. End of story. You have to treat me. You have to become you have to become very, you have to have a nimble way in how you deal with all this, because वो अपनी surgery तो वहाँ नहीं कराएगा. It is very possible कि जो 3 लोग आपके वहाँ पे OPD में बैठे थे, who are ready to get surgery done by you, will also be driven away by this exploitation. I would, want to refrain to share much details about it. These exploitation happen from your own competitive colleagues also. So you have to be extremely careful on that front also. They will send patients to your practice who will do all this and, create a ruckus in the OPD, taking fraudulent cards. So you have to be very tactful. So don't get exploited. Make sure all your documents are in place. Make sure you have a very highly trained staff to save yourself from this. Money recovery, sir, answer to the question. This I had, the last slide, because this can become a problem. Although as far as Ayushman Bharat is concerned, I think the central government has been very, very kind. Within 2 months, your recovery of the money is there. As far as the CGHS and ESI are concerned, that is still lacking a little bit. You need to have your contacts. You need to have your good sort of relationships with those CGHS and ESI managers who are there dispensing the money. आपको अपना पैसा लेने के लिए भी आपको कुछ गरम करना ही पड़ता है. So, to get your own money out, you have to deal with them. And it has become much better because of digitalization. And I'm sure, because this is for the youngsters, it will become much better in the future also. Transparency is increasing, and it will. Thank you so much for your kind attention.
Thank you so much, Rohan, for your brief summarization of everything that is available and how we should take care of ourselves and prevent getting exploited. We would have Dr. Sinha for giving his closing remarks.
Thank you so much, Dr. Pooja. I'm so impressed by the last talk that Dr. Rohan gave right from his heart. He has put everything on the table as it happens in the OPD. Even Dr. Palak's talk was very, very nice, and she clearly outlined the merits and demerits of the TPA. It's something in a nutshell, if we have to say, It's a necessary evil which every youngster will have to go through, which every youngster will have to take. Because cashless is the way to go, empanelment is the way to go. There are a lot of lacunae, there are a lot of shortcomings. India is still a growing country in this field, and we have to still close a lot of loopholes. But to be in the race, you have to be there right from the beginning and not join later. You may miss the bus. So whatever problems are there, whatever sir said that there are difficulties in getting the licenses, so on and so forth, which is so true. But still, I would like to motivate, encourage, and request all the youngsters to still go ahead with the empanelment process, with the government empanelments, with the private empanelments. And it may be a good idea to rewind this and see this presentation and again to get a good understanding of how important, how beneficial it is to get empanelment done. Once again, I would like to thank Dr. Rohan, Dr. Pooja, Dr. Palak, Dr. Anshika, Himanshu sir for the beautiful evening that we had and the beautiful discussion which will benefit so many youngsters throughout the country in future times to come. Thank you so much.
Dr. Gaurav has just joined us, so you can give us your tips and tricks on.
I'm so sorry. Satyajit, so good to see you after 1 week of break. I was in Patna, so had an amazing time. Satyajit is such an amazing organizer. Hi, Dr. Himanshu, and hi everybody else. I'm so sorry that I couldn't join in time. I got free a little late, so I've missed the amazing webinar. But I'm sure I can go back and look at the recording and listen to all the stuff that you guys discussed. And so anyway, I'm here for you guys for 2 minutes as while you're winding up. And Dr. Palak, I can see. Hello, how are you doing? And good to see you, Pooja and Anshika. So I hope you had a great webinar though.
Yes.
But we would want your 2 cents also on empanelment and TPA, and especially the government schemes that are coming in. So I was just mentioning that I'm pretty certain that especially in the tier 2, tier 3, and rural India, Ayushman Bharat is going to take over. The private companies are going to find it very difficult to compete with Ayushman Bharat, actually, frankly speaking, in these cities, because their organization has become better. It's become much better. The only thing that we were scared of from the government was that the organization skill is not good. But with this scheme coming in at a pan-India level, it's going to be much better. So what would you suggest? How does one sort of take this into the future?
I had to let my dog go out. I'm so sorry. He was creating a ruckus. So I've just come into another area. So, so what I think is that things are changing so much. At least I'm in a small town, and things are changing so much that till about 5 years back, only 10% of our work was, like through empanelments and TPAs and cashless and stuff. And things have changed so much that now probably 50, 60 or even 70% of our work is coming through one or the other schemes, and people don't want to. So the whole concept of healthcare in India is changing. And what I can see is that now most people think that, they are not supposed to pay for their own healthcare. It's the government or somebody else's responsibility to pay for their healthcare. It's not their own, prerogative to pay for it. So everybody is looking for one scheme or the other. They want to, take help of insurance or a card or a CGHS card or an ECHS or Ayushman or Gold card or a state health card. They don't want to pay for healthcare themselves. They'll go to the restaurant and pay for their food. They'll pay for their travel. They'll pay for everything else. But when it comes to health, the concept is that this is not my headache. And, so they're compromising as well. They're not willing to kind of go for, I'm not talking about, about 10 or 20% of the patients who are very health conscious and they want the best surgery. They want to go for a laser assisted surgery, or they want to go for paying surgery. They understand the importance of healthcare. But I would say the majority, maybe even 70 to 80% of patients now, they're not health conscious. They don't want to spend on themselves. So that's not a great sign. I think the whole concept of healthcare in India is changing, and it's very troublesome because people kind of belittle healthcare and they don't see value in investing in their health, which I think as doctors, we have to start kind of conveying to them how important it is to spend money on your health rather than spending on so many things, which they would do buying snazzy phones for $1 lakh rupees. But, they'll happily go and buy glasses, progressive glasses with a Gucci frame or a, Cartier frame, $50,000 or more. And when it comes to their cataract surgery, they will not want to pay you 25,000-30,000, which includes the whole surgery and the lens put in. Somehow, somewhere we have to kind of get across to them. So these schemes are taking over and they're paying us much below our cost price, as you said, Ayushman. And the other problem is that many of the empanelments are now linking themselves to these health schemes. It started with CGHS rates, so now BSNL, UPCL, which means our Uttarakhand Power Corporation. Like that, in every state there will be other organizations. They all link themselves to these rates and say that, okay, now we'll be paying you these rates. If you are happy with it, go ahead. And off late, I'm seeing the same thing happening about Ayushman rates, which are half half of the CGHS rates or even less. So many organizations now want you to stick to Ayushman rates. So I don't know where we are headed, but that is the reality, and we have to find ways of going around it and still remain profitable and break even in our services.
I have a question, Gaurav, to you.
Yeah.
A lot of these companies who we signed MOUs with, which were done a few years back, and we had written X amount of rate for a cataract surgery at that time. And at this point of time, now I'll give you an example. We had made a MOU with Alcon IQ and Clarion and all those things. But recently I was putting for an insurance patient a VVT toric, and I said it will be X plus X and whatever amount it was there. And we sent that for the approval to the TPA company. And they said the last time you had an agreement with me, it was only around 40-45,000, and now you have sent it 3 times the cost. This is not going to get approved. Eventually, at the end of the day, they paid only that was there in the MOU first, and the rest the patient had to pay. So how do you deal with these old MOUs which are there? Because they always, if you call and tell them, they'll tell you you have already signed on an MOU which was there earlier.
Yes. No, I agree, Satyajit. What you're saying is absolutely right. We are going through the same thing. Some of these big insurers and TPAs, like maybe MediAssist. What I'm noticing is that we started working with them like Raksha TPA and Youthful and all these 15 years back. That time their rates were like 25-30,000 for a cataract surgery, or even some of them were like 35,000. And today I notice that some of them are wanting to pay less than what they were paying us 15 years back. And there is no, and they will tell you that they want you to do MICS and they want you to put a hydrophobic acrylic aspheric lens and all that. That comes with everything. And they'll tell you that, take it or leave it. We kind of decided that we wanted to, not accept the lower rates, but they happily let us go. And then it was a loss to us because all the other hospitals in the city were doing it. So I don't know what is the answer to this, but definitely we have to keep trying. And I think what helps is that if you're a TPA person, so the big hospitals, for example, a Max or a big corporate hospital, they have good networking with all the TPAs because they're working with them all the time. And I notice that they get paid much better than our small setups, which are, even if small isolated eye care setups are getting paid much less. So for a cataract surgery with they will have much less equipment, they'll have much less expertise, and they will be doing very basic cataract surgery, but they will get approvals of 75-80,000 rupees. And we will be struggling with approval of 30-40,000 rupees and not going to get better than that. So I don't have an answer, Satyajit, but I'm equally troubled by what you're telling. And we face it every day. But then I think what we have to probably do is we have to educate the patients that when they buy insurance, they should ask, I think we have to start doing maybe some educational campaigns through AIOS or IRSI to educate. We can, AIOS has a lot of money in the bank accounts. We can put out full page ads, quarter page ads on the national dailies, telling them that when you buy insurance, please ensure that, you're looking at all these, riders and that how much you're going to get for a particular surgery, giving them examples that, your insurer may pay you only 25,000 for a cataract surgery, which may only get you a very, very basic surgery, whereas a good cataract surgery may cost you a lakh or above. So patients, when they buy insurance, that time they can negotiate with their insurers. So I think we have to start taking that responsibility at our end of educating our patients in several ways. And that might help us because then, the pressure will be on the insurance companies.
That's a good idea.
But do you guys get like multifocal IOLs and femto-assisted surgery? Do you get approvals for that? Toric IOLs we started getting off late. Often we get approvals for toric IOLs if we justify with the astigmatism and all. But we still rarely get it for, a Synergy or a Panoptix or one of these lenses, and especially for a femto-assisted. Dr. Himanshu must be the only one who's getting approvals. He just said, of course, that he doesn't do cashless. So, but I think that's the other answer. If we tell patients, what I typically do is I tell them that if you go through cashless, you are waiving away your rights to a quality surgery. You are going to get settled for something which is low cost because the companies always put a cashless bar that which they don't want to pay for more than 25-30,000. But if you go and claim yourself, you may easily get 50,000 or more. And some patients understand. And others who are very cost conscious, they just say, whatever happens in cashless, please do it. And then I just pass it on to my juniors to let them do it.